Do all patients of sinusitis or sinus infection require surgery? The short answer is no. But first, let's understand what sinuses are and what they actually do to our body. So these sinuses are cavities or empty spaces which are present in our forehead, our cheekbones, and there is also a set of sinus which is present between our eyes. So they are lined by a epithelium, which is a lining. So this epithelium helps in secretion of a fluid called mucus. So this mucus provides moisture to our nose, and it also helps in trapping the dust and viruses, and it stops them from entering our body from the nose. The problem actually arises when there is increase in the amount of mucus secretion. So this mucus will then cause runny nose due to increased mucus, along with headache, pain in the face, and even a loss of smell. So to answer the question correctly, whether surgery is required or not, we need to see the intensity of the problem, that is how severe the problem is, along with the duration, that is since how long is the patient actually suffering from the problem. So if this problem is only since a few days or a week or 2 weeks, then we can easily control it with a few medicines. If there is a bacterial infection, we have to give a course of antibiotics and a spray which has to be used in the nose. But if the problem does not get controlled with medicines, or if there is repeated infections which are occurring, that is, the problem is happening repeatedly despite using the medicines, then in that case we might have to go for a surgery. So to prepare for the surgery, we get a few tests done and get a CT scan done, and then the surgery is conducted. So even after the surgery, the medicines will have to be continued depending on the extent of the disease and complexity of the surgery.